Later on today's episode of On the Other Hand,
some of our patients were having to choose between food for their families and insulin that they need to keep themselves alive and keep working. And here they don't have to make that decision.
This is On the Other Hand, a podcast that features community leaders in Arkansas sharing their views and experiences on how to make our relationships and communities better in our state.
Hello, and welcome to On the Other Hand. I'm your host, April Chatham-Carpenter, and I'm here today with my co-host, Glen White. On our podcast, Glen and I interview community leaders in Arkansas who help work towards solutions across various divides, or who in other ways try to make things better for Arkansans. And we have some great guests on today. So Glen, tell us who we have with us.
Thanks, April. Yeah, we're really happy. We're talking today with two people, Dr. Grant Morshedi and Angela Harris. They are both key leaders for the Harmony Health Clinic in Little Rock, which, as many of you may know, is a nonprofit free medical and dental clinic that serves the health and wellness needs of the uninsured and underserved who live in and around Central Arkansas. So we're really happy to have them. Grant and Angela, welcome to On the Other Hand. Okay, let's start with a brief bow on each of them. Grant, let's start with you first. I'll say a couple of things, then let you add what you want to it. Dr. Grant Morshedi is president of the board for Harmony Health. He's a board-certified ophthalmologist and a glaucoma specialist. He's a native Arkansan, graduated from Hendrix College, and he received his medical degree from good old UAMS. Apparently, he received two prestigious awards during that training. Maybe he'll mention that to us later on. And while he was in medical school, this is interesting, Grant actually helped to establish the free Harmony Health Clinic, which is staffed mostly by volunteers. So he's one of the founding fathers, I guess. He completed an internship after his initial training at UMS at the University of Utah. He followed that with an ophthalmology residency and fellowship at apparently a very well-known center there, the John Moran Eye Center. And Grant maintains what I find a particularly intriguing interest, international ophthalmology. So he has actually completed educational and surgical mission trips to Nepal, Ghana, and Micronesia. So, Grant, what else would you like to add to that?
Well, thank you to you both for having us on the podcast. And I'm grateful to have this opportunity to share with your listeners the important work primarily about what's being done at Harmony Health Clinic. So yeah, aside from a few years during medical training in Utah, I've lived in Central Arkansas my entire life. The main thing that I kind of want to add that's important from my background is that I come from a large immigrant family, and education was always really important to us, stressed to us growing up. And I knew early on that I was interested in the medical field, had some family members in the field. School, luckily, came pretty easy to me. So I was lucky enough to be a good test taker during a time where the state of Arkansas had a really great scholarship program for high school students who scored well on standardized testing. And that really changed my life. I got a great scholarship, attended Hendrix College, and after finishing my medical education, that gave me a really deep sense of loyalty to the state of Arkansas and to Arkansans in particular for putting me through college, essentially. So I was always going to end up back here, back home in Arkansas, and it's very important to me and will continue to be important to me to find ways to give back.
Grant, did you know you wanted to go into med school when you went to college initially?
I had a pretty good idea, but I still had an open mind and I knew I liked the sciences. I just wasn't entirely sure whether I would end up more clinical or more sort of in the research area.
How'd you end up choosing the eye area?
Well, in medical school, again, I entered medical school with an open mind, and during medical school, you have the opportunity to do multiple things. So with my volunteer involvement, one of the first things I got involved in was a program called Student Sight Savers Program, which was a congressionally funded glaucoma screening program. Glaucoma is one of the leading causes of blindness. That's actually my area of expertise right now. And one of the faculty at UAMS who was in charge of running that program, Dr. Tom Cannon, really took me under his wing. And from there, it kind of blossomed. He invited me to join him in the clinic, and I did that. And I tell you what, the first time you see patient who has just had cataract surgery and has had their life changed by going from not being able to see to all of a sudden being able to see, it's really hard to beat that in medical school. I mean, there's nothing like it. So from there, I was pretty hooked.
Thank you. I'm always interested in how people choose careers. So thanks for answering that.
And lucky Arkansas that you did that. So thanks for that. Let's move to Angela now. Angela Harris, she is a nonprofit executive. She's got 21 years of experience doing that and currently is the executive director of the Harmony Health Clinic here in Little Rock. Now, a little bit of a secret about her. She hails from Texas and is a graduate of the University of Northern Texas, but don't hold that against her, folks. She grew up calling the hogs alongside her friends and family all of her life. So maybe she can shed some light on some of that. Angela, what else can you tell us about yourself?
I did live here when I was a kid, but we had a lot of family here. So I spent holidays and every other summer here and went to all Razorback games. So and don't hold the Texan against me. I actually got into nonprofit work. I followed in my mother's footsteps. I was a little resistant there for a while, but about 43 years ago, she started in the nonprofit sector. And so I grew up helping her with fundraisers and going to things like bowl-a-thons and, doing all the fun things to help fundraise for where she worked. And she kind of caught me at a weak moment, trapped in a cubicle, and said, "Hey, come work for me." And I thought, well, I could do anything for a year. And I did that. And then I've had several other careers. Well, only 2 others in nonprofit. And the last one was in medical nonprofit. And I became fascinated with working with the physicians and patients. And we did a lot of things with kids with arthritis and things like that. So when this opportunity came up, it felt like a natural fit where I could put both practical skills together and make a difference.
What kind of nonprofit did your mom work in?
She worked for Junior Achievement. She did 2 locals and then she worked for the national office. And they kind of teach kids like business basics, how to interview, things like that.
It's good to see that your career has been nonprofit. Apparently, you weren't sure at first, but you went in that direction. We always value people who work at nonprofits and do things to give back to the community. So let's move now to maybe a little more detail in your background. Tell us a little bit, each of you, who you are as a person, maybe some things in your early life that got you here, what led you to this point in life and what you do now. Just basically anything you'd like us to know about you. And Grant, let's start with you. Go ahead.
As I mentioned, I come from an immigrant family. My dad was an immigrant, and America has kind of an interesting codependent relationship in my mind with immigrants. There always seems to be a group of them that we as a society decide that it's okay to vilify. And in particular, in the 1980s, it was not always very popular to be an immigrant from Iran, which is where my dad was from. So my dad and aunts and uncles really had to be careful and work hard, and things didn't come easy for them. And I think that story will sound familiar to immigrant community. Looking back, growing up with their stories, even though by the time I was around, a lot of that had passed, but growing up, hearing their stories and experiences really affected how I perceived the world later on in my life. For example, I've definitely heard repeatedly the assumption that poor people can somehow just work harder and lift themselves out of poverty. And I always wonder how many people who think that way have seen their parent working 2 jobs or 3 jobs and still living paycheck to paycheck. There are countless examples of that, immigrant communities, even in non-immigrant communities. And there may certainly be times where one gets lucky and finds an opportunity or a door open that leads to upward mobility. But to reduce it down to the notion that hard work equals success and laziness equals poverty, to me is a real fallacy. So I've always, throughout my life, had the keen awareness that unless you happen to be generationally wealthy, any of us can be 1 or 2 events away from poverty at certain times of our lives. And understanding that fact pretty early on in my life has always given me a particular empathy for those experiencing poverty. And that's what led me to begin volunteering in college and medical school. And it's been a big part of my life ever since. And of course, you know the story of how I got into Harmony. When I was in medical school, I answered an printed ad in the Pulaski Heights United Methodist Church bulletin, where a group of doctors and attorneys were starting a free medical clinic. So both my wife at the time, Anna, well, she's still my wife, but at the time we weren't married. We both got involved on their planning committees. And by the time I moved away for residency in 2008, we had not had a chance to open yet. So they opened while we were in Utah. But as soon as I returned in 2013, I started volunteering to staff a monthly eye clinic. And then soon after that, I joined the board of directors and have been on the board ever since. Angela might say too long, but I just finished a 2-year term as board president.
Okay, I appreciate that. Yeah, the comments about laziness and won't work, things like that, being seen as the cause of misfortune and not getting ahead. It's a good point. Certainly if people don't do their best, if they're lazy and so on, yeah, that's going to have an impact. The reality is there are a lot of other things in this world that are factors that often are not foreseen, that happen to us all. In fact, I suspect we may get into that later, given that we're dealing with healthcare and the fact that you have free healthcare. So I suspect we're going to hear a lot more of that in the future. But for now, let's turn to Angela. Angela, for you, tell us a little bit about your background, who you are as a person, what got you here. Just anything to let us know more about you.
Sure. I'd have to give a lot of my credit back to my mom. She taught me the importance of work ethic and giving back, especially since she started working in the nonprofit sector when I was in elementary school. It made a big difference and led to an impact on me. And it's kind of echoing back what Grant was saying. Working in nonprofit, you don't do it for the money. You do it for the importance of what you're doing in the work. And growing up, I saw her work side jobs and do things and to keep us at the same level we were. And she just always gave back and taught me that importance of volunteerism, and started volunteering in small areas when I lived in Texas. And then once I moved here, I really got my feet wet and, volunteered. Well, I was already working for Junior Achievement for a small time, but then I volunteered for Children's Hospital, and we got to bring breakfast with Santa. We started that over there for one of their fundraisers, just little fun things like that. And I spent 10 years with the Arthritis Foundation, and it was really rewarding. I learned so much because, for example, you don't think kids can get arthritis. I always thought, well, it's inevitable. My grandmother has it. I'm going to end up when I become a certain age. But then we were able to do things like send kids with arthritis to camp and connect all the families together, so they found other people that were going through the same things they were doing. And we were able to help push some legislation, sorry, I can't talk, and do a lot of neat things with adults as well. We did a lot of exercise classes and things like that. And then moving over here to Harmony, it's been fun. It's really rewarding. You never know who's going to come through the door every day. We have amazing volunteers, from medical students to physicians to dentists, and we have a great little homeless population that comes through, and we have a food pantry and all things like that. So we see all walks of life come through here, and it's neat. It's hard to describe unless you've been here.
Well, I want you to be thinking about maybe a brief story you can tell us that gives us a little insight about what it's like to be working in that setting and some of the experiences and people that you encounter, the way you're describing how neat it is. Keep in mind, I think we'd love to hear a little story about that at some point. Maybe both of you could do that.
Okay, we'd be happy to. Grant and I both have great stories.
All right. Well, thank you. As I've been listening to you talk, I'm thinking about starting a nonprofit is one thing. I mean, joining a nonprofit already in existence, like you did, Angela, is certainly important. But starting a nonprofit is also part of the process, right? And so, Grant, you were on the ground level of getting Harmony Health Clinic started. So, what were some keys to getting that started in terms of, if people were listening to this and were like, well, I've got an idea, I had no idea even how to start it. So what would you suggest based
I
on
don't
your experience?
I don't want to overstate my involvement at that time, and I've been involved with several other nonprofits since then. I think a lot of the legwork had already been done. There are legal challenges. Fortunately, we had two of our co-founders are attorneys, so they were able to deal with a lot of the paperwork and registration as a 501c3 and all of that sort of stuff. But really, what it takes is mission. It takes a group of people who are dedicated to the cause. And then, of course, you have to have the logistical know-how. And then in particularly important in a community like Little Rock, where we're a small, tight-knit group, everyone knows everybody, connections. So we'll get into this a little later, but so many of the things that we were able to do and achieve were because of the fact that the people were involved in starting this new people who could hook them up with someone else who could help with this and someone else who could help with that. And it's really, really difficult to get something off the ground like that from a logistics standpoint, from a financial standpoint, but you just got to take one step at a time and build a coalition of people who can get things done.
Reminds me of a recent interview that we just aired on our podcast with Providence Park and how the work that they had to do and are continuing to do to build partnerships and with so many people across different interests and areas. So getting something started. So, well, I honestly also do not know much about what Harmony Health Clinic offers. So I don't know if Angela, Grant, one of you want to just share just kind of an overview of your services that you provide.
We can take it. We provide adults with primary care, health coaching. We're able to do lab services here on site. We're able to give them their prescription medications for free, even insulin, things like that. We have a dental clinic that we do fillings, extractions, hygiene, dentures, and partials. And for a long time, we were the only ones in Central Arkansas that provided dentures for free. And we also, in the last 3 years, we've added behavioral health therapy, and we have a social worker on staff who's also bilingual. And then during COVID, we were able to open a small food pantry up front, and we keep food items in there, toiletries, clothes, shoes. You just never know what somebody might need coming through here. And we're lucky to have a partnership with an organization called Potluck. And every other week, they give us tons of produce and fresh vegetables to provide our patients and try to keep them on their healthier track because many of them are diabetic and hypertensive, things like that. So we're trying to teach them some better eating habits as well. We do also serve underserved veterans on our dental clinic. And we learned that unless you were 100% disabled, that you don't necessarily get dental treatment as part of your healthcare plan. So we've been able to partner with one of the social workers over at the VA, and he'll send us patients on occasion. We're able to bring back smiles to several service members and help them gain their confidence back and do a lot of great things like that.
And I just wanted to add to what Angela mentioned that our focus with our patients on site is primary care. We do have a few specialty providers that come into the clinic to provide services, but we also have a network of specialists that are seeing patients referred from Harmony in their own clinics. My clinic is like that, Little Rock Eye Clinic. We take referrals from Harmony for patients who need eye care and are able to provide that for free. And in the case of if they need surgical treatment, sometimes free and sometimes at a reduced cost or supported costs that are supported by other organizations that we can partner with.
Well, that's great to hear because sometimes you can't deal with everything at that primary care level. So my next question is, who do you serve? In terms of, who can come in there? Does anybody that has needs, or if you have insurance, can you come? I mean, who do you serve?
Well, we have an application process. It's pretty simple, but the patient has to be uninsured and they have to fall within 300% of the federal poverty line. And they also need to provide a photo ID of any type. Doesn't matter if it's a driver's license, passport, or city ID, things like that. And they need to show proof of residence, which would be like a utility bill or like a cell phone bill, something like that. And then if they have income, proof of income. And we have some homeless that do come through here. So we have some special paperwork for them that they can fill out that stating that they're homeless, but we'll still treat them. And a lot of times, and we go through, thankfully, with our clinic manager, who is also a social worker, we're able to help some of them apply for benefits and Medicaid, things like that. So we do as much as we can to help the whole person.
Okay. So Medicaid and that kind of, it would not be considered to be insurance in the same sense of medical insurance provided by an employer, correct?
Correct. But we don't treat anyone that is already covered under Medicaid or Medicare.
Okay. That was my question.
But on the dental side, we do, because a lot of those patients don't have dental insurance to go with the Medicaid and Medicare. So we just won't see them on the medical side, but we'll treat them on the dental.
All right. So in terms of staffing, you have obviously medical professionals that volunteer, I'm guessing. How do you deal with the staffing and what volunteer needs might there be?
We're small but mighty around here. There's only 3 of us that are full time. The dental clinic manager is a registered dental assistant. And then our clinic manager is also a social worker, and she's bilingual. And then I'm here to do the fundraising and all the fun things like that. Otherwise, all of our medical professionals, from dentists to dental hygienists, physicians, medical students, nurses, lab techs, they're all volunteers. And they volunteer their time here. And many of them have been here for years. Some of our medical students, it's been fun. I've been here for 5 years now. And some of them, they volunteered while they were during college, and now they've gotten into medical school, and they're coming back as med students and doing the hands-on training with the attending physicians that are volunteering. And it's just fun to see them grow up and go through the process. And we are so thankful for volunteers, but we're always in need of volunteers. We always need dentists, dental hygienists, registered dental assistants. We need interpreters of several different languages. A lot are Spanish. And then we need retired nurses if they have time, physicians. We have a new APRN that's interested in volunteering. Med students we have from UAMS and also from ARCOM up in Fort Smith. So, and we also need help over at the front desk checking patients in. But then we have fundraisers in the spring that we could always use help with. There's a lot of ways people can plug in here.
It's good to know, because I think our listeners sometimes want to know how they can be involved potentially. So,
and if they can't give their medical time, or if they're not a medical professional, if they have clothing they want to donate or toiletries, things like that, or we've been lucky the neighborhood church has done like hygiene and toiletry drives for us. And Grant's church will give us feminine hygiene products that their parishioners will donate, things like that. So there's so many opportunities here. I would be happy for anybody to give me a call to pick my brain, and we'll get you in here.
I wonder about one other thing. You're talking about the volunteers. You have a social worker that provides some behavioral health services. What about the possibility of other behavioral health providers in the community who might be interested in helping? Is that a potential place for volunteering? If so, what would they need to know?
Yes, just have them call me or reach out to me. We would love to have more. We do have interns that can do the basic, help with resources. Some will, depending on the level, if they're working on their master's, they can do some behavioral health therapy. But we do have other needs that some patients need a little more in-depth therapy that they could really plug in. We really need their help with that as well. So we don't have to always refer out for that.
Very good. Thank you. Tell me a little bit. I want to delve now into your personal values. I think I've already heard a little bit, but just for each of you, flesh out what are the personal values in your life that you developed that translate into the work that you do. Let's start with you, Angela.
I feel like, and I'm trying to teach my daughter this as well. She's 10. That is important to give back, whether it's a little or just even your time and your talents. It makes a big difference in small ways and really large ways. We've had so many people that come through here that are so just appreciative and thankful just because they needed a new pair of socks if they're homeless. Little things like that. Because when you give back, you're making a difference, whether it's small or large. And it's being here is just, I don't know, it's hard to describe the, it just, we're reminded almost daily why we're here. Like if we have somebody that we're able to give them a new smile, just the look on their face and the lives we're changing, it makes a big difference. And we're able to also make some of our patients were having to choose between food for their families and insulin that they need to keep themselves alive and keep working and to keep making a difference in other people's lives. And here they don't have to make that decision. They can still be healthy and still be there for their children and feed their kids. And it's just a very important work to me.
And it sounds like there's just a sense of, I don't know, a joy, appreciation,
Mhm.
a sense of deep meaning when you're doing
Mhm.
something for someone else and you realize they really need the help.
Yes, and it's neat because most of our patients we see on a regular basis and we get to know them, not just medically, but as people. And they open up to you and tell them about their stories and their lives and what they've been through. And it's really rewarding. But you never know what we'll get here day to day.
Yeah, gotcha. Grant, anything from you other than what you've already told us about kind of the values that motivate you?
Yes. To me, the most important value in my personal and professional life is empathy. And I strongly feel that most of what's wrong with our country in terms of entrenchment and hyperpolarization boils down to a lack of empathy. I think if you're truly able to understand what someone else is going through and understand their point of view, it's much easier to feel the need to help, or at a bare minimum, at least to not minimize their concerns or brush them aside. There are plenty of instances, and you may know some people like this, where someone has a really strong feeling about a particular issue and then they change their mind once it personally affects themselves or their family member. It shouldn't have to get to that point before you care about it. You should care if it affects others because it affects others.
So, Grant, you talk about empathy. You think that's really important. It's one of your key values, and you think lack of empathy is implicated in some of the problems we're having in our polarization and other kind of conflicts these days. I want to ask you a tough question because I have heard a few times in recent months from people who are saying that empathy is a bad thing. You know, that it I don't know what else to say other than that they discount the value of empathy. Could you somehow explain to a person who is rather dubious about the value of empathy why it is a good thing and why you think it's an important value for all of us to hold?
So I struggle with understanding that comment a little bit, and I don't think I've heard that. And if I want to be empathetic with a person who thinks that way, I suppose I should try to figure that out. I suppose everything exists along a spectrum, right? So there is probably a way in which one could be almost pathologically empathetic to the point where it may be debilitating. It could cause anxiety. You could probably end up in a place that's counterproductive by really hyper focusing on all that's wrong in the world. I certainly think that's something that can be a struggle at times with everything that's going on. But going all the way to the opposite end of the extreme is also not right. And I think really, to me, it boils down to just having enough emotional bandwidth and intelligence to be able to understand someone else's point of view, whether you're having a conversation or whether you're trying to help someone. There are too many instances where we have someone feeling a strong way about a particular issue and then they only change their mind once it personally affects themselves or their family member. I don't believe it should get to that point before you care about it. You should care about it because it affects others. if it affects other people, it's an issue worth caring about.
Well, that's it for the first part of April and Glen's conversation with Grant Morshedi and Angela Harris. We'll continue this conversation in the next episode, so be sure to check out part 2. And remember that On the Other Hand offers dozens of other interviews like this one. You can find our podcast inside your favorite podcast app or on the podcast page of the Braver Angels Arkansas website at arkansas.braverangels.org.
Thanks for joining us on today's edition of On the Other Hand. On the Other Hand is sponsored by Braver Angels in Arkansas. Music was composed by Randall Standridge of Jonesboro, Arkansas, and was performed by the University of Northern Colorado Symphonic Band, Dr. Richard Main, conductor.
I'm your host, April Chatham-Carpenter.
And Glen White.
Join us in working to make our relationships and communities better.